Now this is Josette Saxton, and I cover mental health issues here at Texans Care. And we do so with really looking at through the lens of not just mental health treatment, but also looking at what opportunities exist around prevention and early intervention. The first set of bills that I wanted to draw your attention to do look at prevention. HB 446 is a bill that aims to prevent fetal alcohol syndrome by requiring medical providers who work with pregnant women to provide education materials on the dangers of prenatal alcohol exposure. The reason I'm tracking this one is that because more than 90% of children with fetal alcohol syndrome disorder have co-occurring mental health disorders, so this will definitely be a good thing. SB 426 is a home visiting bill. This bill would require HHSC to develop a strategic plan to serve at-risk pregnant women and families with children under the age of 6 through home visiting programs. It would charge them with evaluating these programs and also submitting a report to the legislators so we can guide our future work in this area. There are two funding opportunities to support this. There's a rider in the HHSC budget in the Senate bill version that would provide funding for the program, and then also there was a late bill that's filed. It's not included here on this list, but if you want to note, SB 1836 by Senator Dool, he also filed a bill late that would allow a portion of the fees that are collected by the Bureau of Vital Statistics to also be used to support home visiting programs. And again, we're following this under mental health because many of the programs, or I would say most of the programs that are looking at home visiting are impacting children's outcomes related to, or they would promote children's mental well-being. If we can switch the slide now to go and looking at mental health in schools. There has been a lot of attention around mental health in schools this session. The first one here related to training, and what this would do, SB 460 and its House companion, HB 3224, would address pre-service training for teachers. And so again, this is getting at teachers before they are actually in the field while they're going through their own education. This bill would require any educator training programs that require a bachelor's degree to require or to include information on the detection and education of students with mental or emotional disorders. There are other bills that target continuing education for school personnel, such as SB 1178. This one would amend the Health and Safety Code to require school districts to provide and the school personnel to receive training on recognizing students at risk of suicide, students displaying early warning signs or a need for mental health early intervention, and on notifying parents and providing them with information on referrals. School boards would also be required to adopt a policy concerning early mental health intervention and suicide prevention. Currently, there's such a statute for a policy is just permissive. Schools may create these policies. This bill would require schools to create these policies. SB 1178 also includes an immunity clause, so it doesn't create a liability or waive any immunity for the schools. Now, HB 3225 is similar to that last bill, but the bill would not require school personnel to take the training. So the school districts would have to provide the training, but teachers would not be explicitly required to take the training, nor would it contain the immunity clause that the previous bill did. SB 955 is another training bill by Senator Schwertner. This bill would support community-level efforts to provide training to community members on risk factors and early warning signs of mental illness, substance abuse disorders, and self-injury, and on training on how to respond when an individual experiences a mental health crisis. The bill would also provide specific funding so that schools could access 12 hours of that training at no cost. But the idea behind the bill, too, is that other community members would also hopefully get trained in the same, almost like a mental health first aid type training. Going on to the next slide, we have some more teacher training bills. HB 642 and SB 1307 address continuing ed requirements related to dropout prevention. It would require continuing education for teachers, principals, and counselors to include information related to dropout prevention. But given that students with mental illness have the highest dropout rate of any disability group, we work with the office to include language regarding students with mental health disorders. What this will do is increase awareness among educators that mental health disorders place students at increased risk for dropping out, and would encourage schools to seek continuing education strategies targeting this population. HB 917 also addresses training of school personnel, but specifically it's looking at school police officers. The bill would require school police officers to read training that would include things like child and adolescent development and psychology, and really just best practices on how to work with kids with disabilities and including mental health concerns. HB 3491 is a similar bill, but it's more lenient than HB 917. It would only require 12 hours of, so anyway, it would require less hours of training and would allow school resource officers or police officers to have a longer time to actually get that training. The next slide is looking more at promotion and prevention programs in schools. HB 2477 and SB 1352 would include mental health prevention in existing coordinated school health efforts by having TEA identify coordinated school health programs that include the prevention of mental health concerns. It would also look to local school health advisory counselors to make recommendations to their districts on preventing mental health concerns, on the professional development for school staff to build positive relationships with students and to recognize and understand mental health issues, and also to make policy recommendations to the district and the integration of social and emotional learning into academic curriculum. Now, for anybody that's at the Capitol this next week, the bill is up for a hearing on Tuesday in Senate Education, so come on down and support this very good bill. SB 831 and HB 3227 would expand a list that the Department of State Health Services and the Texas Education Agency must compile of effective mental health intervention and suicide prevention programs to also include mental health promotion and substance abuse prevention, which schools could then refer to when selecting these programs. HB 980 by Representative Harless is this one really intrigues me because this is a beautiful little promotion bill. It wouldn't require schools to do anything, but it would promote schools to, or encourage schools to promote student social and emotional well-being through changes to their campus improvement plan by just allowing them to do things like educate parents and teachers on building resilience and instilling positive self-concept in their children and students. If we could switch to the next slide, there's also several bills that were filed related to school counselors. The first set of bills would require counselors to spend the majority of their total work time on actually counseling and providing guidance and not being pulled away to do testing, administration, or coordination. There's also some bills that were looking at lowering the student or the ratio between one counselor or between the counselors and the number of students in a school. If you could switch to the next slide, there's several bills that would help students who are transitioning either into school or out of school. HB 3003 would require school districts to develop back-to-school transition plans for students who spend more than 30 days outside of the school, such as in an alternative education placement, a residential treatment center, or a hospital, and that the plans would need to be developed in consultation with the student and the student's parent and guardian, and also should consider the best educational placement for the student, including the provision of counseling, behavior management assistance, and assistance concerning access to community mental health or substance abuse services. I like this bill. SB 37 and HB 617 would help students enrolled in special education successfully transition to life outside of school and into employment. In 2011 and 12, there were over 26,000 students who were enrolled in special education because of an emotional disturbance. And so what this bill would do is it would help these students as well as other students enrolled in special education on preparing them for, again, life outside of school. The next slide addresses some coordination and planning of services bills, and really just looking at how can we do a better job of providing many of the services that kids with mental health concerns often need. SB 421 and HB 3684 is what I sort of view as our systems of care bill. What this would do is it would help state and community systems to better plan and coordinate effective policies, programs, and services to children and youth with serious mental health concerns by really evolving current systems of care work through this TIPI consortium and charging it with really moving forward on the implementation of a strategic plan that was developed over the past 2 years on how to improve services and support to kids with mental health concerns. SB 50 is a similar bill that would also look to include the needs of mental health concerns in some existing work that's already going on in the state. And HB 2038 relates to the work of the Center for the Elimination of Disproportionality and Disparities. And I include it here because, again, this would be really looking to make this also addressing our mental health system. This bill excites me, too, because I was glad to see that it adds youth voice to the council. And I think for our planning and for our programs, having youth and family voice is critical. If we could switch the slide for some bills related to delivery of services and supports, HB 2887 and SB 1804 would support the establishment of public-private community collaboratives to provide services to and coordinate the care of individuals who are homeless, persons with mental illness, and persons with substance abuse problems. I'm happy to say that we're working with the offices to make sure that the needs of homeless youth and youth with mental health concerns and substance abuse problems would also be included in those efforts. Switch the slide. I just wanted to mention some other efforts related to mental health children in foster care. My colleague Ashley had mentioned some efforts that are going on within the foster care system, but I just wanted to draw attention to some other bills that you can see there. Next slide. As well as within the juvenile justice system. Again, there's some efforts, too, that would help to either, the first bill, HB 144, would assist in the identification and referral of youth who have chemical dependency within the juvenile justice system. This bill has been voted out of the House committee and sent to calendars. And SB 1356 would require probation officers and detention officers and court-supervised community-based program personnel to receive training for working with juveniles who have experienced traumatic events. And then lastly, we have some bills related to data collection. If we want to make good policy, if we want to have good programs and know that we're making smart investments, we need to have data so that we can see where the issues are and if our interventions are working or not working. And so there are several bills that you can see listed there that would help to really so that the state and communities have the information that they need. I'm going to draw attention to SB 44, which really the crux of the bill is to address situations where parents of children with serious mental health concerns who can't access mental health services for the children that they need, and they feel compelled to give up custody of their kids to DFPS where they can receive services. The bill aims to keep those parents off of a central registry of abuse and neglect that will prohibit them from employment, but it would also help us actually track the data about how often that might be happening. And then finally, if you switch, this is the last bill that I'll be covering is HB 1541, which is it's a study that looks at the recidivism rates for juveniles who are committed to either the Department of Criminal Justice, which is the adult system, or the Texas Juvenile Justice Department. But included in that overall study, we would still be able to get a better idea of how many kids that are in the juvenile justice or criminal justice system that have a mental illness, that have received medication or therapy for mental illness while they're involved in the system, or have attempted or committed suicide.